to Interfaith Paths to Peace online programming. Today we have a special celebration or a commemoration of what's called For Chaplains Day. This is a commemoration that was started, I don't know how long it's been going on. It's to commemorate, I'll tell you the story in just a moment, but to commemorate the death of 4 chaplains who died in service to the military and to humanity, and I'll tell you that story in a minute. But Interfaith Paths to Peace wanted to create an opportunity mainly for us to give thanks to all the incredible work of chaplains in our lives and share a little bit about what is chaplaincy work and all the different ways in which people are employed and do the good work of chaplaincy, not only in our city, but around the country. And so we've got several people that are joining us on to share a little bit more about that. We've also got some folks on Zoom here that are going to join in the conversation. So the plan is it to just be a celebration of chaplains and the work of chaplaincy, and to share a little bit more information about that. If you're joining us on Facebook Live, I want to welcome you and also encourage you to put a comment in the comment box on Facebook. If you have a story about a chaplain that's been especially meaningful in your life, I encourage you to write that in on the comment box, and we'll bring that into our time together. Or you're welcome to join us on our Zoom call. The information to join us is there on the screen, so you're welcome to join us there as well. So let me tell you a little story before I introduce our panelists. Let me tell you a little of the story of 4 chaplains today. Today commemorates the events of February 3rd, 1943, when the troop ship, the USAT Dorchester, sank. The Dorchester left New York on January 23rd, 1943, carrying 4 chaplains and about 900 others as part of a convoy of 3 ships. It was torpedoed by the Germans, and when it began to sink, the 4 chaplains of different religions, George Fox, who was a Methodist, Alexander Good, who was a rabbi, Clark Poling, who was a Baptist, and John Washington, who was a Catholic, were helping to calm the passengers down and help to organize an orderly evacuation. But the life vests that they passed out to the men and those who were fleeing the ship ran out. And so these 4 chaplains did not have life vests. And the story goes that the 4 chaplains gave their own vest to others and helped as many as they could into the boats. And then they linked arms together, saying prayers and singing hymns, and literally went down with the ship. These 4 chaplains were awarded a Purple Heart and a Distinguished Service Cross on December 19th, 1944. And in 2006, these chaplains were awarded a Medal of Honor. And so today we want to celebrate that story and give thanks for the chaplains that have served in our military, especially, and given their lives for the good of humanity and the care of other people. But also we want to explore today and give thanks to all of our chaplains that meet us in times of crisis. That's a really beautiful symbol. Chaplains are meaningful as the boat is sinking, so to speak, in all the different ways of our lives that metaphorically happens. So today we're just going to celebrate our chaplains. And I specifically asked 2 chaplains to be with us and to share a little bit about their stories of being a chaplain, what they find meaningful about it, some of the challenges of being a chaplain, and also help us to understand all the different ways in which chaplains serve, not only in the military, but serve in our community. So Dr. Fred Ehrman, who is a chaplain currently serving with the military, is an old friend, not necessarily in age, but years that I've known him. And so I was really excited to reach out to Fred and ask him to be on today. And also Frank Wagon. It is Wagon, is that correct, Frank? I want to make sure I'm saying your name right.
It's Wagon, yes.
Wagon, yes.
Yeah,
Frank is German, so Wagon. And he is the director of chaplaincy services at U of L Hospital and Jewish Hospital. So Fred and Frank, thank you for being on today. And first, I just want to give you a deep bow for all the beautiful work that you do as a chaplain, and we celebrate you today. Fred, if you would start and share a little bit about your journey of becoming a chaplain, what is it, the work that you do, and what you find meaningful about that. Thanks for being on today, and thanks for being a chaplain.
Well, thanks, Judd, for the invitation. I've been a chaplain now for well over 20 years. I'm currently as a military chaplain. I started out on active duty back in '99 with the Air Force, did 3 years, was base hospital chaplain, and really fell in love with clinical pastoral care there. After my 3-year tour, I left to pursue CPE residency, board certification, and also transferred into the Kentucky Air Guard. And I've been deployed to the desert twice as a military chaplain. Right now, I'm the Air National Guard advisor to the command chaplain in Germany. And I work with all the Air Force chaplains there and with the NATO chaplains as well. Being a military chaplain is related to, but distinct from being a clinical chaplain. And so my clinical chaplaincy was hospice and palliative care at the Louisville VA. And since October, I transferred to the Tuscaloosa VA, where I'm now the chief. And then, like Frank, I'm a certified educator through ACPE. You asked in your questions to us kind of one anecdote that maybe is emblematic of the work we do. And so my first desert deployment was in 2001. I was the last of the Air Expeditionary Forces to Operation Southern Watch. So that was at Prince Sultan Air Base, where you had Northern Watch in Northern Iraq, Southern Watch in Southern Iraq. So we flew out of Saudi Arabia along to enforce the Southern no-fly zone. And that was right before 9/11. And so as a chaplain, I walk alongside people, meet them where they are. And so I went flying a lot. I was the chaplain to the operations group. And in those days, right before 9/11, we could wear civilian attire in certain places of the base. And so I was wearing my LPTS t-shirt. And the AWACS pilot I had gone flying with, week before, saw it and asked me if I'm really Presbyterian. Like, yeah, I'm cradle Presbyterian. And he said he was too. And I could tell he wanted to talk. And so we, long story short, is we met weekly for the rest of that deployment. In those days, they were only 90 days. So that's the military side, but there's an intersection with the clinical side, because I noticed as he was talking, and I provided a space for him to share his story, to hear his story as I bore witness to his story. He had a moral injury because he held himself responsible for what the military calls collateral damage during a ground attack. Because the AWAC, he's not, as they say, he doesn't drop iron. He pilots the AWACS, which controls the air battle space. But because there were civilian casualties, as he understood it, this troubled him deeply. And so we stayed in touch for a while, but that was, good Lord, 20 years ago now. But that gives you a sense of what I do as a military chaplain. I don't know how long you want us to ramble, but that's
Well, let's, no, I want to
shot.
hear more about that, and we'll go into some of these stories. That's a beautiful story, Fred. Thank
Awful.
you for sharing. And before we do that, though, Frank, introduce yourself and a little bit about what you do, and then we'll open it up to some conversation. Thank you.
Sure. Yeah, thanks for having me and for shedding light on chaplaincy on this day. So I'm the Director of Chaplaincy Services for the U of L Health downtown campus and have been there for the last 14 years and have worked in most other hospitals in the city over the years, primarily at Baptist, what used to be Baptist East then, and also at Norton Healthcare. Started out at Central State way back when. That was my first training unit when they still did training for chaplaincy. So I came to chaplaincy by way of a Southern Baptist Foreign Mission Board scholarship that they gave to a German Baptist after I finished my training in Hamburg at the university and at the seminary there, and to come to Louisville and take CPE for a year and a few classes. I had my degree already, and I fell in love with that work with CPE, clinical pastoral education, which is a training that chaplains have to do in order to become board certified and become chaplains. And out of 1 year of scholarship turned into 6 years of graduate school and 2 degrees and a marriage and a wife who is also a colleague of mine. She's a director of pastoral care at Norton Healthcare. And we did return to Germany, and I pastored there for a while and thought that probably my career would continue there. And I think we both realized that our heart was really in the clinic, so to speak. We really liked chaplaincy. And then Norton Healthcare offered us, after 4 years in the parish in Berlin, Norton Healthcare offered us an opportunity to come back and have 2 positions there and in chaplaincy. And we knew just that's what we wanted to do. And my journey has taken me, as I said, then to Baptist East for 8 years, and then 14 years ago to University Hospital. And I really like the academic setting. That's why I went to University Hospital. A lot of interdisciplinary work. That's probably one of the things that I really love about chaplaincy work, is that we do the work of healing with other colleagues from other disciplines, and that we have interdisciplinary teams. And I was lucky enough, or had the good fortune from my first training at what was then Kosera Children's Hospital and with the oncology team. I've really worked from the beginning of my career always on interdisciplinary teams. And that's probably a big part for me why I fell in love with the work.
Frank, thank you. Yeah, I think I want to explore chaplaincy, the role of the chaplain, a little further. My sense is the general public bumps into chaplains at these really critical times of their lives, and then next thing they know, the chaplains are gone, and not really always sure what chaplains do or the role. Could you, Frank and Fred, and we have some other chaplains on as well, so I want to open up the conversation to others. But what would you say is the primary role of a chaplain? And I know there's also some different venues in which chaplains serve, but What is it essentially that a chaplain is doing or trying to do? If you can boil that down to some essential roles that you play.
Well, one way to, I think, to put it is that our role is to help, and I'm speaking about hospital chaplaincy, to help patients and their families to utilize primarily their spiritual resources for coping and possibly for healing that works together with all the um, medical care that we can give. Yeah,
Yeah.
I'll stop there.
Fred, what would you say is your essential role?
Well, on the military side, when I went to the basic chaplain course at Maxwell Air Force Base, they told us our role is to be visible reminders of the holy. And that description synced well with me, which was why, like, for example, I would go on the missions when it was possible. And I think and that translates into the clinic as well, that no matter where, I'm thinking of the Psalm, no matter where I go, Lord, you are already there. If I go down into the deepest pit, you are there with me. And in my own experience, there's a tendency for people to associate things are working out for me. I'm towing the faithful line. If things are not working out for me, however that someone may understand that, then God must have turned God's back from me. And so whether it could be certainly in the clinic, someone may experience that crisis and suffer through. I go to church, I tithe, I read the Bible, I pray, and now I've got this diagnosis. Folks will cover that in first unit of CPE. But and so as they begin to really unpack that disorientation, that their cancer diagnosis is not evidence of faithlessness or God's abandonment in that way. And that's similar too on the military side. In my second desert deployment back in 2007, I did a memorial service, and that was a pretty. I remember the commander told me, he says, "Chaplain, I will give you 30 minutes and I will pull the cops off the wall." We were securing a base. But an airman from England had died in an IED blast. And so he shipped his body back to England. He was from that unit, and there were members of his unit still there at the base where we were deployed. And so I synced a memorial service with the service in England. And again, that reminder that here, even in the well of grief, that God's presence is there with them within mission constraints.
Yeah. You know, looking back at interfaith work, it was chaplains who really were some of the first interfaith workers. As we look at, how do we honor these deep historical religious traditions while also honoring, the new emerging spiritual but not religious population. I can imagine that being very difficult because you all will walk in, maybe trained in a tradition, and maybe you have your own faith commitments in a tradition, but you will walk into experiences where it may be a Muslim or a Jew or a Hindu or somebody that doesn't believe in God. Can you talk a little bit about how you navigate the complexity of different cosmologies or different spiritualities? when you walk into a hospital? Or yeah, how do you engage that if you may be a Christian and you're walking in and you're connecting with a Muslim? And I know that there are, of course, Muslim chaplains and Jewish chaplains and of other faith traditions. But talk a little bit about the navigation of the complexities of that.
Rule number one, don't use the word cosmology.
I'm sorry. Yes, that may be a little thick.
Fine.
I mean, you really point to one of the challenges and one of the really crucial differences between, parish works. And I realized that when we get seminary students who don't plan to go into chaplaincy and they know, work in the parish where you basically work with like-minded people who believe the same, or, somewhat the same. And that's an essential skill set, I think, that chaplains need to attend to various spiritual orientations, faith traditions. Part of that is we do, some training about diverse religious traditions, and we take our residents, we take them to the River Road Mosque and let Wasif Iqbal teach us about what would be important for a Muslim patient. We take them to the synagogue and to the Buddhist temple to hear directly from people. I mean, that is one way we get trained, but you really cannot learn anything. For me, it has been, my basic approach is I let the other person, the patient, teach me about what is important to you and how your medical situation, your diagnosis right now, how does it affect that part of your life? Let them be the teacher. A lot of our work I think, has to do with listening, witnessing, helping people connect with their resources. And sometimes they might not be able to connect. I mean, I think people get hit so hard that they might not be able to reach into their spiritual toolbox, where then we have to be the persons who provide resources, or sometimes it's connecting them to resources. I've had Muslim patients who allowed me to be their chaplain and to pray with them. And I had Muslim patients who really wanted to have somebody from their tradition. And then our role is to make that connection. We are lucky to have Mindy Litwin is on. We have a Jewish chaplain at University Hospital, one of my colleagues there, but many, I think there are many departments that are still primarily Christian, where then our role is to make the connection to the community. And I think we all have built or established those relationships with religious leaders, spiritual leaders in the community who can then be available.
Yeah. Fred,
like
what would you
pick up on what Funk said about the patient, the care receiver teaches us and teaches me and allows me to be a chaplain, especially when I'm outside maybe their faith tradition. When I work with the CPE students, I call it part of our reflection is when did the patient ordain you as their chaplain, and were you aware of that? And that happens not because I have doctrinal mastery, defending my statement of faith on the floor of presbytery, or even if I try to pretend to have some kind of doctrinal competence in another faith tradition. I may be aware of it, and I do myself educate myself about other traditions, but I don't go in there as a subject matter expert, but it's really who I am as a person. And can I get connected to my own humanity and meet this person and this person's suffering and in this person's humanity? And that's really where that connection, for me at least, comes, not because I've learned the pillars of Islam with a Muslim patient and want to let this person know, oh, wow, look, see, I memorized some data points about your tradition. In the federal chaplaincy, there's an additional nuance. And one of the justifications for chaplains is to, especially in the military, guarantee the free exercise of religion as a constitutional right, and to ensure that no one proselytizes in the federal facility and privileges or exploits one perspective over the other. So there's that added dimension to it. And on the military side and VA, really, we receive training specifically in that.
Sometimes we have to, I think that's the fear of persons, patients, families who are not that familiar with who chaplains are and what we do, that we come in to proselytize or to evangelize and to bring, to check on them, so to speak. And our professional code of ethics really makes it very clear in all of our training that we cannot impose any practices. Sometimes that can be challenging when patients and families might have different views on their religious needs. I mean, you asked about challenging situations. Sometimes we have situations where we have unconscious patients or patients who are not alert, and the family, for example, they might come and say, we want him baptized, because they fear, and for good reasons, that that condition might lead to death, and they have a belief that in order to be saved, so to speak, you have to be baptized. And if we cannot really make for certain that that's what the patients would want, we cannot provide that ritual, but still have to respond to the need that the family expresses.
Yeah, that's a beautiful example of those difficult spaces. We've got a lot of wisdom on the Zoom call. I want to open it up to, Ronald and Charles Brockwell. Charles is, for many of us that came out of the Presbyterian system, is quite a mentor to a lot of us. So let's open it up. Y'all jump in with your experiences, or if you have questions or comments you want to make, feel free to unmute yourself. And even if it's just to say thanks, right, to all this beautiful work that happens. Charles, would you join us? Thanks.
Yeah, this is always a special day for me. My father was a Methodist pastor, the sort of minister who gives God a good name. And in the early part of the war, he said that he and I were standing on the street corner in our small town in South Carolina. I was about 4 years old then. And transport convoys would come through our town from time to time. And one was passing by that day. And Dad said, some of those boys looked like they weren't quite old enough to shave. And I thought, if Charles was on the back of one of those trucks, I'd want the church to be with him. So he volunteered, and he was in the U.S. Army Air Corps chaplaincy for 3 years, a year and a half as a base chaplain in Wisconsin, and a year and a half in the South Pacific. So the story of the four chaplains has always been very moving for me. And so I'm here today in memory of my wonderful dad.
Thank you, Charles. That's a beautiful story, and brings that home. And thank you for all the work and training you've done with our religious leaders across.
No, yeah, teacher.
It's been a joy.
Yeah,
been a privilege. I'm parish associate with Highland Prayers now, with visitation. And I say,
Cállese, cállese,
Parish associate,
cállese, cállese, cállese,
President,
cállese, 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 cállese.
old
I'm sorry.
preacher who still wants to do stuff but does not want to run the zoo.
Yeah, well, thank you.
You
Other-
bitch.
I'm
Espérate,
sorry,
hijo de
y'all,
tu
we've got
puta
some folks that
madre.
have gotten on. Are there any other questions? Anybody else want to make a comment? Feel free to.
I would just like
El
to
teacher
highlight.
es un bitch.
I'm sorry. Go ahead.
Yeah, no, so far we've talked mainly about sort of patient care or the direct care with those in need in the military. And there is really more to the role of chaplaincy. A lot of our work last year has been staff care, particularly with the pandemic and the additional stress that has created for our healthcare worker. I mean, of all shades, I think our staff care has substantially, well, I know, increased. We are the first at our hospitals. We are the first to respond to critical incidents that staff are involved, to emergency that they experience either in patient care or personally. We provide education to staff about communication, psychosocial, spiritual issues related to healthcare and to patient care. So there's a lot more than just the role, at the bedside, and really organizational care. We are thinking about. I remember I was so touched by the memorial service before the inauguration that I thought, we really should commemorate what has happened last year at our hospitals. And I sent the leadership an email and said, do we want to have a memorial at the day, when we received our first patient, which was March 10. That was our first
Oh, me vengo.
I'm sorry.
COVID patient. So we probably, and that's one way, I think, how we care for the whole organization, that we mark that and remember together really what happened over the last year.
And talk more about that. And Ronald, also, Ron, would love to have you in the conversation. There's this really beautiful balance that my experience has been with chaplains of holding what we would call the pastoral role, and also the priestly role, the role of using ritual to bring meaning or to bring healing or to bring presence. A lot of chaplains for me have held ritual space that allows me to tap into my own pain or my own healing or the presence of the divine. If y'all could share some examples of the use of ritual and how you use ritual to do that. So Fred or Charles, Ron, you're welcome to jump in.
Thanks. I work at Norton, been here a while. Ritual is that event that's bigger than itself because it's connected to past and tradition. And oftentimes people don't really understand the dimensions of the ritual, but they regard the ritual as having force for them, and they want that, and particularly in times of crisis. And I think the chaplain's role, sometimes people, they need to know that somebody believes it's going to be okay, and that's enough. That the chaplain is the loaner of hope, and ritual can be a way that is conveyed. And rituals gotten a little bit tougher because of social distancing. So
Yeah.
we're trying to figure out how to do Ash Wednesday without,
Right.
all of those sorts of things. So it's, but like we have Labyrinth, which is a solitary reflective exercise. And so we've had that out at different times and with some guidance to people on how to use it. And I have this sense that, again, these are really employee rituals for employees, that there is there's a heightened desire to use them to restore what this last year has taken away.
Thank you. Yeah. Other comments there?
Yeah, if I can jump in, this is Dina Carroll. I'm a spiritual care manager
Yes,
at
Dina.
Hospice. Yeah, I've been there a lot of years, and one of the best things I have found about ritual is how it's a container for feelings, and creates a safe place and a sacred place for feelings to be expressed and identified, and that it makes it an okay place to feel things that outside of that space I might be too afraid to express that. So just over the years, that's one of the best uses of ritual that I have seen.
Yeah. Beautiful. Thank you, Dina. Appreciate your comment. Thanks for being on today. Thanks for the good work you do.
Sure, glad to be here.
A friend of mine has said, and I always like that definition, has said rituals are the handrails of faith,
Good.
Mm.
particularly when it's dark and you need to hold on to have actually something that you can touch, something tangible. And one of the most meaningful days in our hospitals is or was before COVID came, which changed so much, was the blessing of the hands during Nurses Week, National Healthcare Week, where we just go around the hospital to the different units and offer this to anybody and any healthcare worker, particularly the nurses, with that small ritual with oil, lavender oil, and touch, and a blessing, non-religious ritual that is inclusive of all, but there's such gratitude for that recognition of what those hands do on that day. So that's a beautiful day.
One of the things, when the little of the CPE work I did, I always was challenged with how to not allow these deep moments of suffering that other people were experiencing, to be present to that and yet not take that home, or to be able to have the energy to walk in out of, I remember I was present when a young boy died with his family, and this was just in my training. And like, I didn't want to go back the next day because I was still carrying the profound sense of loss and grief. How do you all manage being fully present with also not taking on the others? Well, you do take it on in some ways, but talk about managing those kinds of ways with your own energy and your own spirituality.
I think for me, especially when I was doing the hospice work, it really begins with self-awareness and paying attention to, okay, I'm at a stop point right now, and I need to pull away. And I can remember back in the day, we had palliative clinic on Thursday mornings in Louisville, and some of those could be just so emotionally demanding. And I finished getting my notes and have to call the boss and tell him, hey, look, you know, I don't have anything more to give. For me, it's setting that limit or claiming that boundary, stepping back and taking some Sabbath time for myself, which runs contrary to my socialization as a Presbyterian. But really just beginning with that and say, hey, I need to pause.
Yeah. Thank you. Frank, or Charles, or
I think-
anybody else on the call?
Yeah, I think good self-care is important in any ministry function, not just in chaplaincy. I think for me, what has helped to, and that's another really crucial difference, I think, from being in the parish, or what it was for me in the parish, was that I'm part of a team, and I've been fortunate really in all of my positions in chaplaincy, in all the hospitals, to have had functional teams for the most part, people where we trusted each other's, where we could work out conflicts and cared for each other. And so I think for me, it was being there to care for my colleagues and to allow them to care for me. And often that meant debriefing after difficult situations like what you described with the death of the child, or other heavy situations. And that still happens. I think for my work really has a lot to do with that these days, because as an administrator and educator, a lot of my work is not anymore at the bedside. I still do that once in a while, but not on a daily basis. But my work is often with my staff chaplains, and to check in on them and see how they're doing and how they're coping with the difficulties of their job.
Charles, did you have a comment, reflection?
Well, as I've been with people who were suffering this way, I want to help them feel that I am with them, with their grief, but that I'm not in that grief myself. And that's how I can be more helpful to them. You know, just by being there, by saying that what's happening, what you're experiencing matters to the church, and we come alongside you. But there's the first paragraph of the last chapter of Galatians, Paul says, bear one another's burdens and thus fulfill the law of Christ. And a couple of lines later he says, because everybody has to carry their own stuff. And I think we combine that in grief ministry. We come alongside, but there's really no way we can experience what a person who has just lost a spouse or a child can. There's a depth of it that is only theirs, but at least they can know that the church is with them. There's another beautiful half sentence in Acts 14, verse 20. Just after Paul had been mobbed in the town of Lystra, Scripture says they dragged him outside the city and left him for dead. But then here's the beautiful clause that comes after that. But when the church gathered around him, he got up. Yeah. And Lystra is where he found Timothy, by the way. Yeah.
Thank you.
To witness, I mean, Charles, I really appreciated to be with them in their grief, but not to let it be my grief, but to witness their grief.
Yes. Right.
Because that gives meaning to what's happening to them, and that gives significance. And
right.
I had this situation. You asked for one story that sort of exemplifies the work or why it's meaningful. And recently I did actually do a shift on the pager on a Sunday. And I cared, I was called to to our labor and delivery unit, and we had a young woman there who had was about to give birth, and then she gave birth, and I saw her before and after, but she came in from jail. And so she didn't have any family with her. And then she tested positive for COVID, and that led to even more isolation. Only a guard or two guards in the room, and there was this important event that nobody loved her and that she wanted to have there could witness. And after she gave birth, she was so, I mean, she held her little daughter, and it was a beautiful child, and she just needed somebody to share that time and to have somebody there who marks that as meaningful and who rejoices with her about this new life and helps her to think about what it means to be separated from her, because that's, you know, CPS comes in and she goes back to jail and the child goes into foster care, and to come to terms, to think about what that means and what it feels like. So that was I think a meaningful moment for me to be able to be that presence with her.
Well, and meaningful, even as you share that story, Frank, we all kind of stand there with her, right? I mean, we know that there was this experience, and so you're sharing the story allows us to also honor her and offer her wherever she is, and that child is, you know, presence and remembrance. So thank you. Ronald, did you have a story or a?
Yeah, it was when Frank was talking, I recalled been at Norton 31 years. First 4 of those was straight on call. That's all I did was I was the nighttime evening. Did a fair amount after that. But anyhow, in all of those years of being on call, once was I called because somebody wanted somebody to celebrate with them. It was a mom that they had flown in on the plane, and they thought the twins were going to be lost and it was going to be awful, and they were born and they were fine, and it was 2 o'clock in the morning and the nurses were busy, and they called me and says, look, she just needs somebody to come have fun with her. Can you do that? I'm like, I'm up. Yes, I'll do it. But Frank, you know, you didn't have that sad edge of COVID and incarceration that yours did, which is certainly different. You know, going back to your original question about coping, I think we all have our ways, and for me, my way is at the core of being a chaplain is this great privilege that I walk into a room, introduce myself, and very often people just open up, right? And they let me in, or I'm called because there's this death. I was the PEDS ICU chaplain for 9 years, you know, and they let me in. And if I can stay focused on that gratitude that I feel for what they're giving me, and use that as a way to be attentive, it sort of keeps their story from connecting to whatever a part of my story would get activated and anxious, because I'm focused on them and what they need. And I think that coping is a spiritual emotional muscle group that we develop over time. And you know, occasionally we may be very well trained, but we pull a muscle and we ache for a while, and that seems to be, I'm kind of okay with that. Administratively, there are 3 things I say to myself when I want to slam a door or something like that, and I say about whatever it is, it's not cancer. You know, whatever it hasn't been cancer. And then the second thing I say is I chose this, which usually means I can unchoose it, you know. And then my window right there overlooks the children's hospital. And I look over there and I say, there are people over there who would laugh at my stress, who would think that what I'm going through is funny, and would trade what they're feeling for my stress times 2 and go home and never look back. And so it just puts it in a perspective that works for me. I'm not trying to sell that to anybody, but that's truly what I do. I kind of go through those pieces of it, and it seems to be like, okay, it's time to put your big boy pants on and just keep moving, you know. And so that's what I do.
Thank you, Ron. Appreciate that. We've got about 6 minutes left, and I want to give a chance for everybody to kind of have a checkout comment, including all of you that are here. And what I'd like to take a moment and ask you to think about in this conversation, where have you connected, or what's emerged for you, or how are you feeling, or I'm going to practice a little presencing right here, and then ask you to share in 30 seconds, 45 seconds, just whatever is emerging for you right now. So anybody's welcome to start. I'm going to actually kind of go through, and if you would like to share, go Dina, and then Ron, and then Charles, and end up with Fred and Frank. But Dina, would you like to kind of check out with where you are and what's emerging for you?
Whoops. Will you ask the question again?
Sure. It was just a question of where are you in this conversation, what's been emerging for you, and kind of a checkout to kind of harvest what's been moving in us.
For me, it's been gratitude and a reminder of, well, not that it's not there, but just a deepening, I guess, of the gratitude for the ability to walk with people in these mostly very painful, but as Ron reminded us, yeah, sometimes very celebratory moments in people's lives. One of the things that I often get from people as I walk with the dying, like, how can you do this job? It must be so sad. It must be so depressing. And what I have found, and what I often say is, but what I see is so much love. I get to witness so much love. So that's what I take away, I think, from this conversation is another celebration of that for people who have been willing to go walk in painful places with others.
Beautiful. Thank you, Dina. Thanks for being on the call, and thank you for the work that you do. We are appreciative and bow to you. Ron, do you have a checkout?
This call with the folks that are here, minus those little interlopers who came, and I don't know what in the world they were doing.
Yeah, I don't know what that.
They were just kids running through the playground or something. I don't know what that was. But I'm reminded, and COVID helps with this. I think one of my new favorite quotes. Whenever you're in a crisis, ask what it unlocks. And one of the things that COVID has unlocked is the awareness of what a great resource we have in Louisville. With the folks on this call and others. I mean, we have some great leaders, and I find myself imagining, how what we can, how that's a resource, and of perhaps camaraderie would be enough. We certainly don't need more meetings, but what is a resource, and join Dina in the use of the word gratitude for that.
Thanks, Ron. Yeah, I do want to give a deep bow to the work of the Baptist Seminary, the Wayne Oates Institute, the Presbyterian Seminary, all of those. And when we say that Louisville's got like a deep spiritual presence, I think a lot of that is due to this type of interfaith chaplaincy work and the work that's gone on there. So I join you in that celebration, Ron. Thank you. Charles, and then Fred, and then Frank.
Well, I think of Ephesians 2:8-10, which closes, we are new creatures in Christ Jesus, created for ministry. which God has prepared in advance for us to walk in. And when a chaplain steps in with a family, I hope they feel that sense that they're bringing more than themselves there. And they represent community of grace in a way that other people cannot.
Beautiful. Thank you, Charles. Thanks for being on the call today and your presence in so many of our lives and the work that we're being called to do. Appreciate that. And then Fred, and we'll end with Frank.
Well, I've been going through stuff that I pulled out of my mom's house 2 years ago. And one of the things that it's still out here for me to organize is this. I don't know if you all, can you read that?
Yeah.
And just kind of call that a synchronicity that this was in some of my father's things, because he was part of helping Wayne Oates and get set up. I think for me, what really touches me is awareness of the gratitude for this work. I resonated strongly, Ron, with you and what you said about they let me in, and the excitement I feel for that. And also Dina, with what you were sharing too about the privilege, really a holy privilege. And in whatever context I'm doing chaplaincy, I can't imagine any other ministry that I would want to do.
Thank you, Fred. Frank?
It's
Check
all
out?
been said. I mean, the first word that came to my mind when you said, what am I in touch with? So I will use a different word. I will say gladness rather than gratitude, but I'm glad for the connections that I have with people here on the screen. I'm glad that this profession chose me, because I really don't think I chose it as much. When I went to seminary in '82, I did never expect that this is what I would be doing at this point in my life. And I'm glad that this conversation really reminded me of what is at the heart of my calling, because sometimes I get bogged down with the administrative stuff. So to remember.
Beautiful. So I want to close. I want you all to feel what you all offer so many people. So I'm going to just kind of say a prayer or a blessing to you all. And also I'm going to bring in the presence of George Fox, Alexander Good, Clark Poling, and John Washington, who gave their lives in service to the ministry of chaplaincy. And so Dina, Charles, Ron, Fred, and Frank, may you know of the grace and love that you so freely flow with, and may you receive it back to you in spades. And may you know that the Spirit that lives and breathes in and through you is also present to you, to inspire you, to heal you, and to allow you to be the love and the hearts and the hands of our community for those who suffer. We give you thanks, and we give you thanks to the one whom you serve. Amen.
Thank you, Jed.
Thank you.
Thank you.
Yeah.
Thank you all very much. And what a celebration of chaplains today. And so if you're watching on Facebook, and we've have comments on Facebook giving thanks for you all and for the work of chaplains, let's remember our chaplains today, and in all the days to come, may we send them grace and love and strength as well. Thank you all for being on today.
Judd, do we have time for one more story that Frank's presence here?
Please, of course we do.
Okay.
Yes.
There was a game that Robert Kennedy's staff, campaign staff, sometimes played with each other. It was not question and answer. It was answer and question. One person would give the answer. The other person had to come up with the question. Mm. And one of the entries was, Herr Wagner, do you spell your name with a V? And the answer is 9W. So
Thanks.
you give the answer 9W, and somebody has to come up with the question.
Wow.
Good way
Thank
to
you
end.
all.
Thank you all. Y'all have a blessed day. Thanks for being on today.
Indeed.
Thanks for doing it.
Yes, thank you.